Good. They're still coming in. It's good. Good morning, everybody. Welcome to Kingaroy for what is our 20th and largest Town Hall crisis meetings. And we are doing these because we are determined to listen and act on behalf of Queenslanders. Today, you will hear the stories of brave Queenslanders who are stepping forward to drive change in a broken system, and in the process, we want to get justice for individuals. And that is the process, and that is why we are doing these. We want to allow people who have been stuck on the merry-go-round of being waited for, whether they're waiting for elective surgery, whether they have fallen through the cracks and deserve to be heard and have change for their story. But we also want to drive change to a broken system. Queensland Health was in crisis long before COVID. When this government came to office, ambulance ramping was at 15%. It had already doubled before we even knew what COVID was. It is now at 45%, the worst in the country. And in a moment you'll hear from Ros about some of our solutions, but Deb will also explain why this is important to her community and some of the statistics locally that show a broken system that people are falling between the cracks of. We are determined to put forward our solutions, and we are doing what opposition should do, and that is holding the government to account, but also putting forward solutions as we are listening to Queenslanders. They include better resources, better triaging, sharing data in real time, but above all putting local doctors and nurses back in charge. And nowhere is that more important than in the regions, where people live in these communities. They know what needs to be done. They know the resources, they know the people, they know the way to fix the Queensland health crisis. Our message for the state government is very clear. Start listening to everyday Queenslanders. Start listening to the people who want to be treated with respect. Start listening to the frontline staff who want to drive change in a broken system. I'll ask Shadow Health spokesperson Ros Bates to say some words, and then we'll hand over to Deb Frecklington, who is our host today. Over to you, Ros.
Ros Bates, Shadow Minister for Health and Ambulance Services and registered nurse. Queenslanders deserve a world-class health system no matter where they live. And make no mistake, Queensland Health was in trouble long before COVID. We have the worst ambulance ramping in the country. And why does that matter for people here in the regions? Well, that means that if your child is having an asthma attack, your father is having a heart attack, or your grandmother has fallen over and broken their hip, you will be waiting longer than you should be for an ambulance. And why does that matter? Because your life could depend on it. We know that our staff are under incredible strain, and as a registered nurse and former hospital administrator, I know how hard it is for my frontline colleagues right now. They are exhausted. They were exhausted working double shifts long before COVID. We have a government who does not respect and care for our frontline staff. They have been calling for assistance for such a long time, and they are now leaving the system in droves. We are here today for our 20th Town Hall, Health Town Hall, and we are listening to locals. We are listening to whistleblowers, and we will act on anything that comes out of these forums today. This is a government that currently has no plan, doesn't believe whistleblowers, doesn't believe patients, and stopped listening a long time ago.
Thanks, Ros. Well, I'd really like to thank David and Ros for coming out here to Kingaroy to listen to my locals, to my constituents, about the crisis that is happening in the South Burnett, and that is right here in the Kingaroy Hospital. Unfortunately, I have had numerous whistleblower nurses. Unfortunately, I've had heaps of constituents who have suffered a great deal of pain up at the Kingaroy Hospital, whether it's because every second person that goes up to the Kingaroy Hospital has to wait twice as long as clinically recommended. That is not good enough. And if Kate breaks her arm while she's playing for the Kingaroy Red Ants on a Friday afternoon, that her parents have to put her in a vehicle and they have to drive her to Toowoomba, a couple of hours away, just to be seen to, that is not good enough. Now, we know that if you live in Blackbutt and you're waiting on a hip operation, just like Bob is, He's been waiting for years. This is a health system that is in absolute crisis. So I'm pleased to see this amount of people here in this local hall. But I'll say this, I wish there was no one in the hall, because then we would know that there wasn't a problem with our health system. So I'm looking forward to hearing from my locals today. But I'll say this about the Palaszczuk government. Anastasia Palaszczuk and the Palaszczuk government are so bothered with their own integrity crisis, they're wasting $220 million on WellCamp. And that money could have been spent by better supporting our regional nurses, our regional doctors, and fixing our regional health system. That's what we want to see. But instead, we've got a Palaszczuk government that is so busy and tied up with their own integrity scandals. They've lost their way. They've forgotten about the kids that are breaking their arms in regional Queensland. They've forgotten about the mums who are having babies on the side of on the side of the road. They've forgotten about people like Bob from Blackbutt, who actually is sitting in a wheelchair waiting for a hip operation right now. Thanks, David.
And that's why it matters. Over to you. This is the biggest, and for a small community it shows you how much pressure the staff are under and how it is impacting the community. The state government made a lot about building a new facility here. It was overdue and 50% over budget. And the horror stories we are hearing about how poorly made and designed it was, the stories we hear about frontline staff not being valued, the people who are not being seen on time, they're harrowing. And surely the state government can sit up and listen to this. People are still coming in. This is a small community and you've got a couple of hundred brave people who are telling their stories. And already we've listened. I just spoke to somebody who drove from Emerald because his son keeps falling through the cracks and keeps having his surgery cancelled. Surely that is alarm bell territory, and surely the state government will finally start listening and acting.
The stories about people going to hospital, to the Kingaroy hospital, and then being told to go to Blackbutt to see the medical centre.
And that's why we're here. Deb asked us to come here because her office was being inundated. These are real Queenslanders who are getting the runaround from a government that isn't listening and isn't acting. And I reflect on how much things are about the image of those in power in this state rather than the image of people waiting in lines for hospitals that can't see them because they are at breaking point. And my advice to the Premier would be maybe to spend a little less time listening to the media spinners in her ear and a little more time listening to the real people who are behind us.
How do you intend to bring doctors to regional areas?
I'm going to ask Ros to make some comments, but we've put forward a range of incentives. Now, one of them might be working with the federal government when it comes to HECS and dangling the carrot there. But I'll tell you what Queensland Health could do right now. They could start valuing the people who work here. They could put incentives in places to ensure that families relocate to areas. And if you do that, two things will happen. One is doctors will fall in love with the region and you've got a better chance of them staying. The second is you're going to have continuity of care, because what's happening at the moment is we're having locums come in, often at 3 times the price, and you don't have as good a service. So Queensland Health would be far better if they respected and treated their staff with dignity, if they remunerated them properly, if they put incentives for families, and that would in the long run be cheaper and provide a far better service. Do you want to add something, Ross?
It was the LNP who actually tripled the rural generalist program when we were in government, and that's something that this government has yet to do. David mentioned we need to make packages attractive to retain and attract doctors in the first place. When they come, they're not just single people, they've usually got a family, so there needs to be a job for the partner, there needs to be schools for the kids, there needs to be housing for them, and as mentioned before, incentives so that the packages put together to make them want to come here and make them want to stay here, because once they do come out to the regions, most of the time they do actually love it and want to stay.
This is not the first time you've done multiple forums. Are there any particular themes that have emerged or any particular areas of concern?
Certainly we've been able to help patients who have been waiting for their surgery. We've had patients who've had their surgery cancelled 3 times, once on the morning on the table. We have taken those stories to the Parliament when the Palaszczuk government accused the LNP and accused patients of making stories up. Well, these are not making stories up, and you'll hear some of them today, and every one that we hear of today we will act on as we have with all of the other forums that we've done.
You said that you would take action on anything that comes out of these forums. Is that a promise?
Certainly that's what we've been doing, and me as the Shadow Health Minister, I make representations to the Health Minister all the time, and we know that once the government knows that we know about it, something usually happens.
You got it again?
Oh.
Yeah, you bet we will.
Yeah.
You bet we will.
100%.
Righto, we'll go and get cracking. Thank you. Thanks very much.
The staff that are here are